Good afternoon, and thank you, Naomi. I want to thank you for inviting me. I want to thank the Judy Nicholson Kidney Cancer Foundation. Nick, you're an inspiration for all of us, and Linda, and your entire team. I've been knowing Nick now for a couple of years, and since I first time I went to Florida, where I was invited, and I was really impressed by your passion and motivation. So, and the fact you're here with your foundation, hopefully, will Naomi will be able to create something also here. So, like we did in Indianapolis. So I was asked to talk about nutrition and kidney cancer. I'm not a nutritionist. I'm a medical oncologist, like Dr. Haas. And but I got interested a few years ago, and I'm gonna show you why I got interested. So these are my disclosure, but my real disclosure is this one. I don't have anything to do with these nuts. I don't sell it. I don't make money out of it. Apparently somebody is using my name, but actually I was actually in Buffalo, and one of my patients brought me a jar of these nuts and said, you gotta try this, they're delicious. And I said, wow. And then I look at the top and said, Pili nuts. So anyway, what I'm going to try to do is to discuss how nutrition and diet may have an impact on patients with kidney cancer. I think also in general in patients with cancer, but I want to make the case my heart and soul is in kidney cancer. And I'm going to tell you about our story. We're trying to develop how a specific diet intervention called protein restriction can help the result of immunotherapy. So when I just started with the definition of nutrition, we talked about nutrition, diet. What is nutrition? This is one of the definitions, but I think I like it. Nutrition is nourishment or energy that is obtained from food consumed or the process of consuming the proper amount of nourishment and energy. An example of nutrition is eating a healthy diet. And that's what should be our goal, to always have a healthy diet. And why focus on diet and cancer? Well, this is a data in prostate cancer, but I believe it is applicable also in breast cancer, and maybe one day we're going to find out also for kidney cancer, that indeed a diet that is rich in vegetables or legumes seems to decrease the incidence, perhaps, of cancer like prostate and breast, make it a little bit less aggressive as compared to animal protein, where a diet with high count of red meat has been associated with the higher stage of disease at the time of diagnosis. And there are some epidemiological data suggesting indeed that the consumption of protein, high protein, especially animal protein, may be in general associated with high incidence of cancer. And there's always been, probably you heard about this data in several publications, several reports, but when we look at the population of patients that, for example, they have a very low incidence of, cancer, like Asian or Japanese, in terms of breast and prostate cancer, when they move to the United States, the incidence of cancer goes up. So suggesting there is something in the environment, and of course the first thing that comes to our mind is nutrition. And my colleague Luigi Fontana, who is a very well-known nutritionist in aging, has shown now that the low protein diet can indeed have an impact on important growth factors. This one is IGF, it's called insulin growth factor, that is implicated in aging, but we know that this is a major growth factor that drives many cancer, including some type of kidney cancer. But now we have evidence very strong evidence that diet can have an impact in cancer. This is a recent publication in breast cancer patients. This is we call a longitudinal study. So these women has been followed up for many years, and they were actually geared to a low-fat diet or normal fat diet. So look at the component of fat in the diet. And now we have evidence that women that were consuming, had been consuming low-fat diet, had not just overall decreased mortality, they live longer, but they have also a decrease of breast cancer mortality. So they die of breast cancer less if they were eating less fat. We do have guidelines from the from an answer from the USDA, governmental agency, how eat healthy. Unfortunately, we are not aware of those guidelines. As a physician, we are not providing this to our patients. But there are some key messages from this recommendation that if we are meant to make some changes on our diet, like we should, the key, and I think is one of the key take-home message, that we need to do in the small changes. You know, drastic changes may not be long-lived, but if we do small changes, may help us actually to achieve our goal. And our goal is to eat healthier. Again, I don't know if you can read this. Again, these are going to be on the website. You're going to have this reference material. But these are recommendations actually from the American Cancer Society. Guidelines on nutrition, so healthy diet and physical activity to prevent cancer. But I want to make the case that this is not just to prevent cancer, but also from many of you, if it's not all of you, who had cancer or used to have cancer, how this intervention can help you to keep the cancer quiet and to delay the time when this cancer may come back. And some, I'm not going to go over through this, but these are sometimes probably common sense, but achieve and maintain a healthy weight throughout the life. This is a key recommendation, and I'm going to mention to you about this, that you need to know your body mass index, how much weight you have. Physical activity, again, as I mentioned, to keep your weight down, and consuming a healthy diet. And the common sense is really to give preference to plant-based type of vegetarian type of diet. Again, I don't think we need to advocate to be all of us vegetarian or vegan, but increasing the quota of vegetables, fruit of vegetable, is part of having a healthy diet. And one is drinking moderately. We know the consumption of alcohol across the different type of cancer may have an impact, not only on the progression of the cancer, but also on the response to therapy. Know your own BMI, it's called body mass index. This is a chart that you can download over the internet. But what it tells you is that based on your height, there is an ideal weight. And you're not surprised how many people are considered to be overweight, obese here in the United States and the Western world. Because, again, we're not following a healthy diet. We don't do enough exercise. But there are some evidence now that the BMI can have an impact on cancer incidence. There are some opposite effect perhaps on treatment outcome, and this is an interesting topic, so I'm not going to touch today. These are slides that I put as up with the help of Beth Kirsch. Beth is a registered dietitian at the IU Simon Cancer Center in Indianapolis, and Rachel Bordogna also is a registered dietitian and nutritionist helping me with the activity I'm going to mention to you later on. But the bottom line of my talk is that we should, every patient with cancer, in particular patient with kidney cancer, should have access to do registered dietitian. And I'm going to not digress too much right now, but the big challenge that we have, why cancer patients do not have access to a registered dietitian, unfortunately, is because of the reimbursement cost. Medicare or CMS allowed only patients with kidney transplant, being obese or had diabetes, to have access to a dietitian. Cancer patients, they are not, there is no recommendation, and that's something hopefully will change in the future. But this is the goal that a cancer dietitian should work with each patient, and particularly patients with kidney cancer. Identify healthy eating, risk of malnutrition, and how help the patient to make some changes, small changes that can adds up. Again, we talked about the goals, the treatment. There's a lot of emphasis how nutrition and diet can help with the side effect of therapies. There is strong evidence that fasting before chemotherapy in patients with breast cancer seems to be to reduce the side effect. I think there is a lot of work that we can do. For example, in patients with kidney cancer, we have side effects from receptor tyrosine kinase inhibitor like cabozantinib and sunitinib, how the diet can help the cope with the side effect. Again, these are the main goals. We talked about weight maintenance, and I think this is really achieved by knowing how many calories patient needs. And how do you count your calorie? How can figure out when you're eating and when you have your food in front of you, how many calories actually you're introducing in your body? I'm going to just mention briefly about malnutrition, that we deal with this in patients with kidney cancer primarily at the later stage of the disease, unfortunately. And it might be an issue more for patients get surgery for other disease. I think about like a colon cancer, or head and neck cancer, or esophageal cancer, where patient cannot eat for a prolonged period of time. But malnutrition is a problem, and we know malnutrition can have an impact on the immune system and how patient can respond to immunotherapy. And these are some of the way to recognize what malnutrition is. Decrease energy in over 5 days and within a short period of time, a relatively fast weight loss, and fluid accumulation and decreased functional capacity. And there is a link between malnutrition sometimes and inflammation. Let me tell you, even as a physician, to me, inflammation, we hear about inflammation, we still do not know what this inflammation is. But we know and we sense that it's not good. And unfortunately, patients with cancer and patients with kidney cancer may have high level, we call, of inflammation. And the bottom line is really inflammation is a disorganized immune response. The immune system is actually overreacting and is not focused, for example, on fight cancer. And that's why we link inflammation with immunotolerance, meaning that the immune system is in some way fatigued and cannot really concentrate on fighting cancer. And there is some evidence that diet and nutrition, so healthy diet, can help to reduce the level of inflammation in the body. And reducing the inflammation can have major impact on patients, not just cancer patients, but also patients with arthritis, for example, with heart disease, diabetes, of course, where sugar control is a main part of treatment. This is still, I think, an uncharted territories, but the common sense seems to provide some evidence that actually the processed food, excess meat, and especially red meat and saturated fat, can increase the level of inflammation in the body. So we should try to avoid those food and eat more plant-based food. Why plant-based food seems to be better? Because they contain more vitamins, more minerals, and more fibers, and also these phytochemicals that, again, is a large family of compound, but that can indeed have an impact, and it's been shown in animal models on the level of inflammation. These are recommendations that Beth actually provides to her patient when they come to the clinic to see her, and how much fruit and vegetable you should eat. This is just an estimation, but 1.5 cup of fruits and 2 or 3 cups of vegetable every day. This seems to be a common sense recommendation, and she would suggest that you fill half of your plate with vegetable fruits. And also change the way you think about meat. Use it as a garnish. I think psychological think this is a good way to treat your brain. Limit the meat that you eat every week or once a week if you do, and use beans. We don't use a lot of beans here. Depends on the region where you live, but as a great source of proteins, beans can be substituted of beef. And again, these are the recommendations to increase the source of protein from beans, seeds, and nuts, because again, do not just provide a good source of protein, but also other components like minerals, fibers, and healthy fats. Recommendation is actually fish. We are doing, I'm gonna mention in the next few minutes about our work in animal studies, and we give a fish extract in our mice, and the fish extract seems to have the same beneficial effect as a soy extract. It's like a plant-based. So not all the animal proteins are bad necessarily. Healthy fats in cooking and eating. As of course, an Italian person, I cannot live without oil. I could not cook without olive oil. There are some believe that olive oil is not good, but I think in moderation is like wine. So plant-based eating, whole grain, you heard about whole grain, how we can switch our diet to increase more whole grains. And why is that? Because, again, the high fiber content, there is more and more evidence that the more fiber you eat, not only you're going to have a regular bowel movement, but they will help actually your immune system. We still do not know the biology. But these are all the good things the whole grain has. How do you recognize this? This is, I think, as a picture, help us to switch from the refined grains and to whole grains. And so, white rice, we should eat more brown rice. Cream of wheat, we should eat more oats, and vice versa. So, looking for whole grains in the label of whatever you're eating. And of course, I think avoiding simple processed sugars, this is a common sense that we should always entertain as a nutrition, as a healthy diet. And as you know, sugar is contained in the sodas and in many foods. And I'm going to mention later on about the dogma that many patients have, that the sugar will feed my cancer. I personally, I don't believe that is true necessarily. And there are definitely some cancer that may be more depending on sugar, on the glucose, but if there is no glucose there, the cancer will still be able to survive. So, but I think there are other reasons to decrease the amount of sugar, especially the processed sugars. This is the classical Harvard healthy eating plate that you probably saw in the past. Again, You can download it from the internet, but really summarize all the things that I just briefly mentioned previously. What are the components in the diet that we should give priority in terms of fruits and vegetables and whole grains? And this is the classic, again, coming from Italy, like Dr. Porta, we're very familiar with these pyramids, and I think Mediterranean diet doesn't have some common ground in terms of healthy diet or nutrition that we might take an example as shown here. So my take-home message about nutrition, again, this is a very short overview, but that's what I recommend to my patients, especially when they entertain the treatment with immunotherapy. Avoid dairy products. I'm going to mention to you some experiment we'll be doing in mice and red meat to try to minimize this source of animal proteins. Again, as I mentioned, increase plant-based protein and fibers, increase cruciferous vegetables. These have a lot of antioxidant, and eat more fish. Multivitamin supplementation, I think the idea that we should have a multivitamins capsule every day, I'm not sure that we need it. I think there are plenty of vitamins in the fruit and vegetables. If anything, vitamin D and vitamin C, I think has the strongest evidence that can actually modulate the immune system. And there are some clinical trials trying to prove that. And definitely any change in diet should be integrated with physical activity. I want to leave some time for questions. But I want to tell you why, as a medical oncologist, I get interested in nutrition. A few years ago, again, I met Luigi Fontana, who has been also working with Walter Longo, and he was working on protein restriction, as I mentioned, as a way to delay aging. And we decided, well, why we don't look at protein restriction in prostate cancer or in cancer in general? And we did this small paper, now almost 7 years ago. And we look at prostate and breast cancer, the same result. This is data on prostate cancer. And we put this tumor in the mouse, and as you can see here, we monitor this tumor through the time. This is the time, the days after we implant this tumor, and this is the size. We measure this tumor. And this is just the effect of changing the amount of protein in the diet. So we can provide the mice that are carrying this tumor with pellets that have different source of protein and different amount of protein. So we change the protein from 20%, 21% is the normal amount of protein, to 7%. That's the only change we made. And actually we increased the amount of carbohydrates. So these mice have the same calorie, but the source of calorie was different. Less protein, a little bit more sugar, actually. And this is the result. And I was astonished. That's really what they start everything for me. Because if I give hormonal therapy or chemotherapy to these mice, I can achieve the same result probably. But this is just diet. And this is either we changed the diet a month before we started, we put the tumor, or we put the tumor, we let it grow, and then we put the mice on the diet, pretty much the same effect. And this is the concept that we've been working on, and we published recently last year another paper where we find out now that reducing the protein in the diet, at least in these animal models, we can affect the immune system. In particular, we've been working on macrophages. These are one of the cells that help our immune system. There are good macrophages, bad macrophages, and where we show that the diet, in this case, a protein restriction, can increase the good macrophages that fight the cancer. And not only when we give drugs like nivolumab, in these mice, we increased their response to immunotherapy. To me, that was very exciting. And so when we give the immunotherapy to these mice, in the mice that have less protein in the diet, these might live longer as compared to the mice that have just immunotherapy or they have just protein restriction. And to me, this is just an animal model, and this is a kidney cancer animal model, and that's why we want to translate this in the clinic. But this is the first evidence that indeed diet can, protein restriction, and perhaps other intervention can help our patient to respond better to immunotherapy. And there have been a paper last year also from a French group showing similar data, how protein restriction, very small amount of protein restriction can actually increase the immune system and delay the time where cancer may come up. With Luigi, we wrote an article in Nature Review of Urology, try to come up with some potential mechanisms how protein restriction have an impact not only on the cancer cells, but also the immune cells. It's still a work in progress. I want to tell you about this project that we have with Rachel Bordogna here. Rachel is a registered dietitian and nutritionist from Purdue University. And she's not at home, but this is a metabolic kitchen. It's in the hospital. This is a kitchen that helps us to prepare meals for studies for patients. And we open a study right now in patient with prostate cancer where patients are randomized to either low protein diet or normal protein diet. So we reduce the amount of protein in the diet. And these are patients receiving a vaccine called Sirpolusil-T. And we're going to do this study similar in patients with kidney cancer, where patients are receiving immunotherapy, and to see whether a lower amount of protein in the diet can help the immune system to work better. But what does Rachel do is cooking meals and prepare meals. So we providing meals for this patient for 7 weeks, and that's the same things that we want to do eventually with patients with kidney cancer. And we have a project at Indiana University and the Cancer Center where we're going to start, we have a program to collect tumor at the time of nephrectomy, put it in vitro, we call it these organoids in 3D culture, we're putting in mice, and we're going to try to see where a different type of diet, protein restriction, high fiber content diet, or maybe alternating fasting, there's a lot of interest on fasting, with that particular tumor may have an impact. We are not going to be able necessarily to look at the immune system necessarily, but at least the metabolism of the kidney cancer. We know that kidney cancer, as our group, our friends and colleagues at NCI told us, is a metabolic disease, is a metabolic cancer. And so this is a new frontier for us, for many of us, how the diet can affect cancer growth immunity. There's a lot of interest in how the diet have impacted the bacteria in the gut. I'm not going to go over that topics today, but we have evidence that protein restriction seems to shear the bacteria flora in the gut to a more healthier bacteria. So we opened a snack clinic at Indiana University. This is actually one of my colleagues came up with this name. I say, I love it. Snack without K. So Science, Nutrition, and Cancer Clinic. So we open for now just on Monday afternoon. And myself and Rachel, we see any type of cancer, including kidney cancer. But we want to start doing is really follow this patient on a monthly basis or every 3 months and try to achieve some goal. Whether it's a weight reduction, a calorie count. We're going to start collecting some information about osteoporosis and how the diet can help with that. But this is a platform for us to also to collect blood sample and stool to learn more about the inflammation and how we can reduce the level of inflammation in our patient. So this is I think it's one of my last slides, but that's the concept that I'm really passionate about it. And I think that should be our goal. It should be the goal in our cancer center, should be goal in our community, to have now a personal trainer. And I think your physician is your main trainer, but I think there are other trainers, social worker, patient advocates, but dietitians should be part of the team to help you to have some goals and to have, at the end, a healthier diet. Because at the different stage of the disease, your needs, your nutritional needs are different. That's my dream place where patients should be receiving their care. I mean, the classical clubhouse place where patient comes to get the infusion, what is immunotherapy, learn how to cook and how to eat healthy, do some exercise, so do meditation. All these things are important and should be part of cancer care, in particular kidney cancer care. So these are my last slides. I think for anything, if anything, I want to leave you with that. You know, we need to work harder on provide nutritional support to our kidney cancer patient. And our particularly interest in Indiana University is to integrate diet with immunotherapy, but improve quality of life. This is really our goal. Not only quality of life, but also outcome. And thanks to Nick and Linda and the rest of the foundation, we're about to open this chapter to really provide that infrastructure support. So I want to just thank you for listening, and I want to thank again Beth Kirsch and Rachel Bordogna to have me to put up this, set up these slides for you. Thank you. Since I'm not going to be able to stick around at the end of the day, so if there is any question, I'd be more than glad to answer now. Please. Good question. And I think for patients with the impaired kidney function, I think we start working with our colleagues in nephrology who already have perhaps some recommendation in low protein diet and low salt diet as keep your remaining kidney healthy. So this is absolutely important, and that's why it's important for us to work as a team. But to me, it makes even more sense to think about this more plant-based diet, especially if the kidney function is not good. I think that makes even more sense. Yes?
You mentioned alternate fasting. I've been trying to avoid breakfast, just eating lunch and dinner, about 12 to 15 hours.
Alternative fasting is fascinating. Alternative fasting is fascinating. There are some preclinical data in mice where they have these calorie mimetics. There are some drugs that may mimic the calorie restriction. Alternative fasting, we do also alternative fasting experiment in our mice. What I can share with you, in our model, when we do alternative fasting and we combine with immunotherapy, we don't see the same synergy that we see with protein restriction. So does it mean that is wrong? Probably not. That's why I think it's something that we should look into it. I think you heard the obesity is one of the main factor for kidney cancer. We don't know the link. Could be these growth factors that are in our fat. The more fat we have, more IGF we may have, and they may induce kidney cancer. If that's the case, I think keeping the weight down, even if you already have kidney cancer, perhaps is important. So I see alternative fasting definitely a good way to control your weight, for example, but this can be paired or could be paired or should be paired with the physical activity. So I'm not sure if I answer your question. I think if it makes you feel more energetic, some patients feel better doing this 16-8 or whatever schedule you pick. I think it makes a lot of sense, especially if it help you to keep your weight down. When I consider immunotherapy, I'm not sure whether one diet intervention fits everybody. And I think we're going to need to personalize that. But probably the level of inflammation probably may go down with alternative fasting. That's what they've been shown. Yes, in the back. So your plant-based diet. Yeah, and we did, yeah, again, we don't know exactly the link. I mean, epidemiologically, it seems to be that population that eat more fruit and vegetables seems to have less. Yeah, organic, that's I don't know. I think it's an open question. I think it makes a lot of sense. As nutrition, a healthy diet, that probably organic, it makes more sense. To avoid especially pesticide and chemicals. I mean, it does make sense. In the far back? Yes.
Is there a blood test that measures inflammation in the body? Do you recommend that one?
Yeah, good question. Unfortunately, there is no single. There is probably a combination we call cytokines, chemokines, C-reactive protein, the SED rate. There are level of inflammation, but it can be also elevated with cancer. So we are now prospectively looking at a panel of markers that can help us to see whether they are modulated by protein restriction. And maybe that will give us an answer. Yes?
As a kidney cancer patient, do you interact with SNAP remotely, or does it require visiting Indiana?
Good question. I think in the future we'll make it probably web-based. Maybe we're going to try to do with the Judy Nicholson Foundation. So, that's something that will definitely. We just started from small, but we see that so much need. And I think we need to be creative how to support that. Currently, I'm supporting this dietitian with money that I have for research because unfortunately they cannot bill. So I think the program has to be sustainable in the future. But I think that's something that definitely we would love to explore. So whenever we're live, we're going to make the community aware. Very good. Thank you again.